little bit about yourself?
About myself, I'm an Australian citizen. I live in Melbourne, Australia. I'm married and I have 3 children, and I've been working as a sonographer for about 30 years. Originally I trained as a radiographer, so I did some radiography for a couple of years, and early on I became interested in ultrasound, and I worked as a sonographer and a radiographer at the same time. So I trained in ultrasound, still working as a radiographer. We work in the same department, but the sonographers do ultrasound patients, and so we have X-ray rooms and ultrasound rooms. So the sonographer would be doing scans each day. So we'd have patients booked for us, abdominal scans, obstetric scans, maybe vascular scans. We do a mixture of different types of scans where I work. I work for a large public hospital network in Melbourne, so we have 4 large hospitals, and we do all sorts of different ultrasound examinations. So mostly the sonographers are employed just full-time as sonographers. They're not doing a mixture anymore. Most sonographers choose to do that job full-time now. So different types of examinations that the radiographer would perform. They do plain X-rays, plain films, so that might be chest X-rays or X-rays of the skeleton, spine X-rays. They might be involved in angiography, so vascular studies, X-rays. They might be doing mobile X-rays, so going to the ward and X-raying the patient on the ward. They do usually have to do some special training to do CT and MRI, and some of the other things like mammography is a more specialised form of radiography. So I guess a radiographer might do some of those examinations or might do all of them, depending on their training and on their workplace. And also theatre work. They might be involved in doing X-rays in the theatre during operations or procedures in the theatre. The thing I like most about my job is the variety, because I get to scan lots of different examinations, so it's not all obstetrics or all abdominal work. I get to do a bit of everything. It's also very challenging. We have to be very involved in the diagnosis, and so we need to keep up to date, attend lots of conferences and lots of seminars, and keep up to date with new technology, new information. And the thing that about ultrasound is the technology's always been changing and improving, so every couple of years we get some new technology or improved equipment that gives us better imaging, better image quality. So I think that's been really the most interesting part, is the variety. The thing I like least, I guess, is the stress. I guess it's a very busy job, and so you always, the day goes very fast. There's a lot happening in a busy hospital. There's sick people and they're often upset or in pain, and so you need to deal with that as well as doing the job that you're asked to do. So you need to look after the patient and do the job that you've been asked to do. So that can be quite stressful. So it's not really that I don't like it, but it can be a busy day, a very stressful day sometimes, with a lot of demand for ultrasound. We always can't keep up with the number of bookings, and very much in demand sonographers in Australia. So probably sometimes we're short-staffed and we're trying to do lots of patients, and it can get quite stressful, but still a good thing. So the Board of Examiners for DMU Asia are a group of sonographers and doctors from ASUM in Australia, as well as some of the tutors and staff from Vision College. So our job is to oversee how the DMU Asia students are going to be examined by ASUM. And I guess we set up the board about 18 months ago just so we had a group of people who could liaise together and work together to, I guess, ensure that the training and the examinations were conducted fairly and kept up to the standard that ASUM asks for. So the students that I've seen come through Vision College, and I've come here for a few years now, have been very impressive. I think they're very enthusiastic. Probably most of them work very hard towards becoming good sonographers. They're polite, they're caring for the patients that I've seen them scan, and I think they'll make good sonographers. I think they're well trained, and I think the course is of a high standard. So even though they have to work very hard when they're learning, they will come out of it in the end and be grateful that they were trained so well, and that they were given a good opportunity to sit exams that are of a good high standard. And I think it can be very difficult learning to be a sonographer and going through the studies that are involved. It requires some hard work and dedication, but I think the students that I've seen come through here, and I have seen a couple in Australia a bit later on when they've been out for a while and they've moved to Australia. I've actually come across a couple, and they've done really well, and because generally I only see the students at the point of their examinations, so I don't really get to see them a couple of years down the track, and it would be really nice to see how well they're doing. But I think they are hardworking, they're polite, they're very caring of the patients that I've seen them scan, so I think they've been well trained. So I think ultrasound's got a bright future. I've worked as a sonographer for 30 years. I've always had a job, I've always had a choice of jobs, and I've had no problem travelling overseas and working overseas because the qualification is recognised, my qualification from Australia is recognised overseas. So it's always been a really valuable career for me because of the high demand, and I would see that high demand continue for the next few decades.